Visions Therapy. I'm your host, Isha Robinson. And in an effort to kind of get more people into therapy, I just kind of wanted to take the time to debunk 10 myths about starting therapy. So the first one is therapists give advice. So we guide, right? We kind of get you there, we don't tell you what to do, right? You are the agent of your life. You are the change maker. I can't tell you within 5 minutes of meeting you what is best for you. I can help you see and help you pick a path that you are in charge of. 2, therapists are not your friends. And that's a great thing, right? Because your friends can tell you things that's fully injected with their bias. So a therapist is having an unbiased look. She's she's pulling on different things, and it's not going to be something that they are injecting as far as what they've been through. So yes, so I've had times where people are like, Disha, can we have a drink? No. No, we cannot have a drink. I know you can't hang out. There are some people I wish I could hang out with because they're really cool. It's like one of my favorite ones. Therapy is for rich people. I mean, I don't know. I guess, this is my thing. I want to be rich, so get me a therapist. If that's going to get me. No, all right, let me stop. In all seriousness, no. A lot of you guys who are insured have access to mental health benefits where it could be something as little as a $20 copay, and your insurance will pick up the rest. So you just find someone you really, really like and see if they take insurance. And there are even times, like let's say who your provider doesn't take insurance, you can submit to your insurance company for reimbursement. So no, therapy is not for rich people. This is a big one. What does talking do? So talking is amazing. There are times where I've pointed out to people who have progressively gotten better, what has really changed about your situation? You're still in the same job, you're still making the same amount of money, you're still in that relationship per se. Your mindset changed. How you're thinking about it, how you're going about it changed, and you're happier. There's a level of acceptance that has happened. So talking does a lot, and I think the release, sometimes you have, I have clients that come in and it's just like they just want to talk, forget, anything that I have to say, and then you allow that space because it's your time, it's your space to do what you want with it, and you don't have to fear judgment. So talking is great. All therapists do the same thing. Okay, so first of all, therapists have different degrees, different levels of specialization. And I think it's important for you to know, and actually this should actually be a separate, the video, because it's so important. And I could literally talk for about 15 minutes about the different specialties, but you have people who are specialized in families, couples, singles, chakras. They like to kind of put that. You have people who subscribe to a positive psychology approach. Some people, are more cognitive behavioral therapy, which means, your thoughts, your behavior follows your thoughts. So why it's so important when people say, listen, if you meet a therapist and they are not your cup of tea, because sometimes you just don't fit, right? They have a different ideology. They're trying to take you to a place that you feel like you don't need to go. Find another one. It really, really is that simple. And I think, they teach you, or at least they should teach you, when you go to a doctor and you feel like, I don't really know. And you may go to get a second opinion. Like, you know what, let me go get a second opinion because I'm not really feeling it. I think everyone should do the same thing with therapists. Listen, this is not who I'm feeling. I'm not really feeling you. You know, you're not doing what I need you to do. Realistically, whole other conversation. Find another one, for sure. So, just because you see a therapist does not mean that you are crazy. Okay? It means you need help, possibly. Maybe you don't need help. Maybe you're just like, listen, I want to make sure everything's good. Like, I just want to, you know, I have never really explored certain things, and I just want to, it's good to kind of have that conversation. So, you're not crazy. Like, it's, you know, I think that's a stigma, especially, I want to say, in where I came from, right? I have a West Indian background. That was one of the biggest things, like, oh, you need a therapist, and they start, you know, looking at you, side-eyeing you. But no, you're not crazy. If anything, you're making a active step to get help and to ensure your happiness. So we scratching that one out. We're not hearing that in 2020. That's not what we're doing. 7, therapy's lifelong. Therapy should not be lifelong. You should definitely feel like you should have actionable steps. You should feel like, you know what, 3 months ago I was here, and then you may not be 100%, but you should feel like, you know what, this got a little better. You should be able to see that. Depending, there are some traumas that really take a while to erode and kind of dig down deep. But as long as you feel like it's being targeted. But your therapy should not be lifelong. In fact, if you are seeing a therapist for 3 years and you feel like nothing is changed, you may need to switch. The idea is for you to have the tools that you need to kind of move on. You could have like a follow-up session. You could have like a check-in every now and again, every couple months, just to make sure things are going smooth. But the consistent level of therapy, no, you should not need. Number 8, tell me what's wrong. There are so many people where nothing's wrong. Nothing's wrong. And actually, it's going to take me longer than a session to figure out what, you know, box you may fit into. And I think that this comes from just Western medicine, and we're used to seeing medical doctors. So you're used to the kind of like a doctor, they're trained, right, to find what's wrong and to treat it, right? Okay, you're having this symptom. How can I stop this symptom? How can I fix it? We're trained a little bit differently. And I think that, you know, because you're nervous, because you're shy, and I feel like sometimes that is becoming, you know, the new social anxiety. No, you may be shy. You know, you have, you know, oppositional defiant disorder. No, you may just be acting out. You know, so we don't have to medicalize everything. Not everything is a diagnosis. And if it is, and if you do have a diagnosis that requires medicine or something like that, yes, absolutely. Who you're seeing, your therapist should be able to recommend that level of care, to say you should see a psychiatrist because X, Y, and Z. But a normal expression of feelings, you know, is not something that's wrong. You're just having a feeling. So I love those, you know, 10 minutes in, oh, what's wrong with me? And I'm like, you just might be really normal. How terrible is that? Therapy for a boyfriend-girlfriend relationship. So I just hate when people, like, you know, discourage stuff that could make it better for you, right? So should you get therapy in a girlfriend-boyfriend relationship? Absolutely. I think the earlier the better. I think if you see things in that person that feel like, you know what, this is something that I want to invest in and see where it goes, I'm all for it. Yes, of course, I think marriage therapy is, you know, more prevalent, I guess, because it's marriage. So, you know, people are like, well, you do what you can to save your marriage because it is costly and it's a lot that goes into divorcing someone. I think a lot of emotions go into a breakup as well, right? So a divorce is a little bit more tangible, but I think that there are a lot of things that go into that breakup, and you should 100%. If you feel like, I'm sensing some issues, but I want to invest in you, I want to invest in this, and I think that if we get this together, if we can communicate, you know, we can get married, we can take off. Or maybe you don't want to get married, you just want to have a lifelong partner. So the earlier you get in, the better. The worst thing that I see is when people come in, couples, married or not married, and it's like, you could tell this is like the last ditch effort. It's like, I'm here because, first of all, I don't even love this person anymore. I'm really here because, you know, I heard that therapy could help in some way. So I'm going to see what therapy does. It's like, I can't help how you feel. You know, I can show you things. We can expose things, you know. But you, at the very least, still have to have a basic level of care. And if that's gone, that's tough. It's an uphill battle for us in therapy. But yes, the earlier the better. All down for boyfriend, girlfriend therapies. Girlfriend therapies. Boyfriend therapies. You do not need to be in the name of holy matrimony and decide that you then need therapy. Can't tell you how many times I've heard, I'm gonna pray about it, you know, or, you know, girl, you don't really, literally, girl, you don't really need therapy. You just gotta pray. 100%. I think you could use both. I'm strong on the fact that I think that, you know, God created therapy, God created therapists, right, for a reason. And I think it's especially powerful if you can bring those two together, and use people's faith and what they truly believe, because spirituality is so important. Like, what you believe happens to you, or what do you believe is, where's your morality? And I think that is what drives that for a lot of people, which is if they're grounded and rooted in faith. So therapy does not ignore it. You know, it depends. You know, is this what's needed to kind of get through this topic that we're talking about? If it's not, you know, we may skirt by it. But if it is, and if it's something powerful, and if it's something important to you, bring it. You know, we're not afraid to talk about it. I love to learn about different religions and kind of what they believe and how, and the rituals. And I think it's really, really cool. And we can mix the two. We don't have to choose. We don't have to choose between the other. I think I just heard this one. I'm not even gonna lie. So I already had these 10, and then I heard this, and I was like, oh no, this has to go in, but couldn't figure out what I wanted to take out. I am telling my business. Yeah, listen. You telling your business, but how many times we told our business and, you know, it didn't help? Like, you telling your business in a way to help yourself, and we don't view it that way. You know, when you talk to, you know, when you've been in the therapy game for a while, you hear so many things, like nothing is really surprising. And I'm not looking for that. Like, some people are listening to hear things that are enticing to them. They're listening to hear a good story. I'm less interested in that. I wanna hear a theme. I wanna hear kind of, I'm thinking about how you're dealing with situations, how you're presenting in front of me. You know, what about the stories making you anxious, mad? So I'm having a whole separate thought process that doesn't include judgment. Right? That doesn't include, oh wow, like this is really crazy. Because that would be terrible. You know, that would be kind of, you know, what would be the point? What would be the difference between me and a friend? And I think there is, when I went to therapy, because of course, to be a therapist, you have to be in therapy yourself. It was great feeling like, okay, for this amount of time, I can literally be myself. Like, and I think we have to be so many things to many people. If you're a mom, that's a role. If you're a sister, that's a role. If you're a dad, that's a role. And you sometimes can't fully express what it is you want to express. So at least for that time, you can express it. You don't know your therapist personally. So I love that. You know what I mean? So you're telling your business, but to work through whatever it is. And please understand that is not how your clinician is receiving it. They're not like, oh, this is great. This is great. It's more so using it to figure out how to reframe it to help you. Or sometimes it's really not helpful, and we just kind of check it. So this has been great. Thank you guys for tuning in to this video. Really wanted to kind of debunk some of the things that prevent us from going into therapy, and I hope this kind of gave you the push to at least try it out and kind of see what you come up with, especially if you're in need. All right, enjoy and have an amazing day.